My name is Leslee Thompson, and I am the Chief Executive Officer for Accreditation Canada and Accreditation Canada International. Standards and accreditation are two key features in the assurance of quality and safety in healthcare systems and in organizations, and right down to the individual level. It's got both of the what's expected, how to improve, and how do you know that you're making progress. I actually think that the whole approach to accreditation needs to be disrupted. It is somewhat antiquated and out of step with where the realities of what people say that they need in terms of assistance to progress toward the excellence that they are striving for. We've got a lot of systems and processes that people, through what was originally designed as a positive step with peer review against set standards, the original approach fit a particular point in time. And today, I think that because the environment is much more complex, we have tools and approach that are out of step with the realities. We've got a lot of standards, a lot of processes that people spend an extraordinary amount of time, energy, and resources preparing for accreditation. And I believe that a lot of that time, energy, and money could be channeled in different ways if we had a more relevant method and approach to actually driving excellence. It starts with the answering the question around what are you trying to achieve, and making sure that you're really centered on the why. Why do we have standards? Why do we need accreditation? And what difference does it make ultimately in the lives of the patients and families that we serve? What we've learned in Canada and through our experiences abroad is that the design of the standards, the co-creation of the standards with people in the system, with patients, with clinicians, as well as with those who are stewards of the resources, that together the standards can be designed with much more relevance when it is that kind of an approach. A lot of times people say that the most value out of their work with standards and accreditation comes when they're actually reflecting themselves, that self-assessment, as well as when they can be part of a more global learning community and really understand how they perform in relation to others and how the processes line up with outcomes. This is a big gap in a lot of the approaches right now, and we are working on closing that gap. One of the most critical questions we need to be able to answer is what value is being created through the use of standards and through an accreditation process. And I don't think we can answer that question until we actually bring together a variety of sources of information and perspective and evidence that can help us see whether or not the processes that are in place to achieve standards are achieving and delivering any impact. So what outcomes are we getting? There are a lot of organizations across the world that have examples where accreditation is granted and people receive exemplary standings, and the evidence of the clinical outcomes that are being achieved is not in line with that. And that's a gap that diminishes the credibility and relevance of accreditation, and that's where we really need to focus our efforts on kind of reinventing the approach so that truly it is delivering value to patients, providers, and policymakers. There's enormous opportunity if we think about the standards as a catalyst for change for the major reforms. As an example, need to be looking right across the system. So taking what are often called required organizational practices and standards that happen in a particular organization and moving those to the system level. What are the required system practices? What would medication reconciliation standards look like from a patient perspective in a journey right across the system? Standards can be designed in a way that actually drives people toward a goal, as opposed to being a rear view mirror checkpoint of whether or not they've got the right things in place in the individual parts of the system. The challenge for accreditation of tomorrow is to be focused on helping to drive change at that full system level and looking at the connection of all the parts, and ensuring that the ongoing evidence that's generated from understanding how the whole system works feeds back into the development and design of new standards that can then keep moving us forward.